Hello, I'm George Perry, and I'd like to share with you what we're trying to accomplish with our course, Implants A to Z. My part of the course will be covering the restorative perspective, and really we're looking back over 30 years of what works and what really creates predictability in our practices. A lot has gone into the thinking about this course and creating the sort of situation where the success rates that we have, our ability to satisfy the patients are at the highest possible levels. We have thought a lot about this, and how do you take a patient where you have a tooth that is going to be lost and be able to successfully and relatively simply replace that tooth with an implant and then take that patient through a provisional stage and then give them a restoration that is exactly like what they've lost, to give them that natural look that they're all hoping to achieve. And really that's our goal. Is this as simple as it seems? Well, it can be, but understanding the parameters both from a restorative and a surgical point of view is what really matters. And so from my point of view, what I'm going to do is really try to cover the restorative goals. So how do we create this predictability? And there's some questions we need to answer throughout this course, which will cover 7 basic lectures and then several different course presentations, which include case presentations and different issues that I think will exemplify what we're trying to accomplish. Does the position of the implant matter? Well, yeah, of course it does, but we need to define from a restorative point of view what we're hoping to achieve. Soft tissue. So many people put the implant in and then hope that we can create soft tissue. From the beginning, how do we create the soft tissue? And when we can't, what could we do from a restorative point of view to create the soft tissue? How about support, stress, restoration failures? How do we deal with those things? All those things I think need to be addressed during treatment planning so we're knowing what we're trying to accomplish. So what is our philosophy? And really it's a biologic philosophy, understanding the relationship of the implant to the bone, to the soft tissue. When we understand that and we place that implant in the right position, our success rates, our patient satisfaction rates go up. And really that's the bottom line to all of our treatment, to give the patient what they want. There are limitations. We also need to understand what those limitations are during treatment planning so that we can effectively communicate to the patient so that they understand what is going on and what their individual case might produce. When we can talk intelligently to the patient right from the beginning, then it's not looked as a failure. It's looked as, well, this is what we expected, we have agreed to this, and this is where we've ended up. Our goal is to create the most natural, ideal restoration. We don't need to do this on every patient, but when we understand the biology, when we understand what the potential is of our implants, of our restorative treatments, then we can produce the kind of results I think that really make us proud and make the patients so gratified that we're able to do those things. The basic idea, the implant needs to be in a perfect, ideal spot to create the restoration we're looking to achieve. There's basic numbers, and we'll go into all those things, but really that's from a surgical point of view. But for us as restorative dentists, we need to understand what the goals are. Because if we know what the implant can accomplish, what the final result will be with any given implant placement, we can speak more intelligently to the patient to get the result that we want to have. I still believe in a team, even though I think all of us can place implants. But when we have a real good team, we have the restorative dentist, we have the surgeon, we don't forget about our orthodontist, our endodontist. We use our team together. We have a great laboratory support and a supportive office staff. When we have all those things together, our results can be outstanding. But we need to work together. So basically for me, our goal is to be successful. Our goal is to achieve outstanding and predictable results. When I'm predictable, when I know what I can achieve, it just makes everything so much less stressful. There are limits to what we can do, but there certainly are things that are really remarkable that we can do, and we want to be able to do them for our patients. So even down to the point of practice management, how do we present these goals to the patient? How do we get them excited about treatment? How do we make the patient part of the team? Those are all of our goals as restorative dentists. And over the next 7 lectures, including this one, I hope we can accomplish that, and I look forward to working with you. Thank you very much.
For more education programs, visit the Guide Institute at www.guidedental.com. implant.com.